Hello, I'm John Falardeau, Senior Vice President of the American Chiropractic Association. I'm here today with Dr. Vern Saboe. He's the Director of Governmental Affairs at the Oregon Chiropractic Association and a longtime member of the ACA Legislative Committee and PAC Board. And for several years now, Dr. Saboe has been working tirelessly to implement a law in Oregon that would mirror part of the 2010 Affordable Care Act, which we simply call Section 2706. A non-discrimination provision that prohibits insurers from arbitrarily excluding a health provider from participation in an insurer's network if the provider is acting within their scope of practice. Now, we've been working to get the feds here to issue a rule pertaining to this provision, but you've worked starting in 2012, I believe, for Oregon to get ahead of the curve because, as we know, the federal government works at a glacial pace. So, Vern, tell us a little bit about that work that was started and the process going forward.
Yeah, sure, John. So to back up, part of the critical nature of this is being a member of the ACA and part of the legislative committee, in that you kept us appraised of what the large coalition of non-MD provider groups were doing with the Accountable Care Act, Obamacare, as it moved towards the Senate. And a lot of folks had angst about a national healthcare system. And when it got going towards the Senate, that's when I think the coalition really said, we can't, either you're in the kitchen helping to make the sausage or you'll most assuredly be on the menu. So, and he went to Tom Harkin. So being involved in this national association and getting that information was critical to me in Oregon, because at that same time, John Kitzhopper, MD, medical physician, ER doc, was running for governor. And I had never met the guy, but I knew of him, and he was favorable to our profession. I know this by a colleague of mine down in the Roseburg area where he originally worked. And so having that information from you and the ACA as the governor's race unfolded and the PA and the Accountable Care Act, Obamacare, passing with Section 2706 in it was very, very timely. And so I worked on John's campaign because, I knew he was going to win, and got to know him. And I told him I want to be involved in healthcare. And so I guess my overall message before I get into all the details is get involved. You have to be involved. You have to take the time to get involved. And I'll talk about that a little later. But several states have taken my recommendation, but I'll explain that later. But so in 2010, Governor Kitzhopper wins. I tell him I want to be involved in healthcare policy and helping to improve healthcare in Oregon. I want to be on any type of groups you put together. Well, he put me on what was called his Health Systems Transformation Team. And in 2010, it was our team and I was the only healthcare provider that was a non-elected official, wasn't a member of the Senate or the House. I was the only healthcare professional on this whole 48-member team. And so it was our team that created the state's what are known as coordinated care organizations, CCOs, kind of MCOs on steroids, all relative to the Oregon Health Plan and administration of health care to the Medicaid population, apparently, ultimately. And being in that situation, I went to John. I said, look, we've got to get this federal law, Section 2706, into Oregon state law applied to CCOs so they cannot discriminate against chiropractic physicians or any other healthcare provider. He said, I absolutely agree. And in 2012, his bill, there was two bills that had the language, 1580 and Senate Bill 1509. They passed. They included the Section 2706. And again, very, very critical being involved. The current governor, Governor Tina Kotek, was the co-chair of the House Rules Committee when this was going through. and the House was split. Hope I'm not going into too much detail. The House was split, half R's and half D's. So you had 2 chairs, 2 vice chairs, 2 speakers, 2 of everything. It's actually a good thing. It made them forced them to work together.
Very unusual.
Yeah, and so, but the Republican side of the aisle, who was very supportive of 2706, saw that as a bargaining chip on late night negotiations, and it was majority leader on the House Democratic side, Tina Kotek, who fought in those negotiations to retain 2706. She's our governor right now. So that passes. CCOs have to rely on 2706. They cannot discriminate. And the one issue was the varying reimbursement rates based on quality performance measures, because the congressional record was not clear on what exactly that meant. And it didn't help, and I'm not going to go into it didn't help that the Center for Consumer Insurance Information and Oversight, I don't know if I got that right, been a while, came out with flawed guidance to the state's insurance divisions, which just threw a monkey wrench in everything.
Right.
So anyway, so continuing on, and so we got it into Oregon law. We talked about the need for varying reimbursement rates based on quality and performance performance measures, and not on some arbitrary, like the CMS maximum allowable physician fee schedule, but based on outcomes. And the one who is on the record, and I used this just recently for that opinion, was our current governor as the co-chair, saying, well, it's very clear, and she lays it out for the legislative history, and courts look at that. So the next thing was, now we wanted to apply 2706 to the state commercial health insurers, health carriers, because the feds were not enforcing, as you know, 2706. And so in 2015, I was placed on a work group, thanks to the governor, Kitzhaber, that drafted a bill that involved individual and small group plans, and the original draft had all the non-discrimination 2706 language in it. It was David and Goliath on this work group. It was me representing the chiropractic physicians, Dr. Jeff Hart representing the naturopathic physicians, and Steve Kafori, a lobbyist representing the acupuncturists and doctors of Oriental medicine. The other, I think, 14 members were all representatives from commercial health insurers. The first 3 months, they all came after that language. But the insurance commissioner leading the meetings, we met for 9 months, would not budge. You could see it on their faces. They go, what? She listens to us on everything else. What is with this? You know, well, it's because the governor, Kitzhaber, had given her marching orders to insert that in there. He wants that in there. She never divulged that. She just didn't budge. It was great. Mm-hmm. So then again, continuing to get enforcement. That's been the key. In 2017, we, and I'm not going to go on the reasons why we needed to do this, but the commercial health insurers, again, were playing games with the language. So in 2017, we went to, with the help of then Governor Kate Brown, a chiropractic patient, and a longtime friend, gave the insurance division marching orders to go in administrative rulemaking as per coverage, because they were, well, we don't typically pay chiropractors for those services. It may be in your scope, but we don't tend to pay chiropractors for that service. Well, the administrative rule we got was that if it's in the scope of license of a doctor of chiropractic medicine and they provide it, you got to pay us for it. So we got that into rule. And then and then the next was applying this to, there's a number of things else that took place that were positive, but another biggie was under current Governor Tina Kotek, we got Senate Bill 822, which we lobbied for. It was her bill, but we were helping, and included 2706 applied to all large fully funded commercial health care plans.
Mm-hmm.
So, but now we're talking about a universal health care plan in Oregon, and kind of model after the Oregon Health Plan. And I've been testifying to the need to continue this legacy of non-discrimination against providers and spelling out what varying reimbursement rates based on quality performance measures means versus the CMS arbitrary maximum allowable fee equation that they utilize, which really disadvantages our solo and small group practices, because a large degree of our income is spent on staff, rent, equipment, maintaining the facilities. Well, the large physician hospital organizations have us at a huge disadvantage in that regard, because most of their providers are employees. So the big issue continues is getting proper enforcement of 2706. We've got the law and the federal law, we've got the state law, it's getting enforcement of the law. And so, and the legislative council opinion that I orchestrated through my senator to get something like this, other states may call it something else, but the attorneys that draft bills to make sure they don't conflict with the state's constitution. Right. I'm sure in other states, it's a member of the legislature that has to ask them a question or question to be answered. You as a state person or a voter can't do it.
Yeah, let's get into that, Vern, because that was you sent that to us a little bit ago, and they issued a pretty comprehensive ruling related to the Oregon law, especially as it applies to reimbursement. Can you expound a little bit on what Legislative Council came back with most recently?
Well, it was which is very valuable to, if we end up in a court of law, is to really, and by the way, I've orchestrated, what I mean by orchestrated, I've written the request letter for the member. And because they're busy, they got a million things to do, and they don't have the expertise, they don't have the knowledge to put what you want on paper. So you put it on paper for them, and they love it, they appreciate it. That's
the same everywhere.
Yeah.
Here in Washington and in every state capital. Yep.
And so the common thread. Yeah. So the deal is that of all the legislative council opinions I've orchestrated, this is the single most comprehensive thing I've seen ever. This attorney really did a wonderful job of getting into legislative history, not only just on state, but on the federal level, and the back and forth. And of course, I included a lot of those materials, including an audio tape of the current governor saying what varying reimbursement rates based on quality performance, the significance of that, and the interpretation of it. And that's how we should do reimbursement. So what it really did was go through all of that history, because on the federal level, they really didn't have a discussion in committees in Congress regarding 2706, the meaning and intent of that language. It was just in there. I mean, it was the bill was 1,000 pages long or something. And this was one small section. So what it really did was, and the intent was to really lay out the legislative history, quote legislators, quote prior bills, and when there was any ambiguity, include logic and reason, the logical inference of that conversation that happened in committee clearly supports that, the intent is not to allow discrimination as it relates to reimbursement, not just coverage and participation. Mm-hmm. But it also explained that coverage means that if it's a covered health benefit and that provider provides it, it's in their scope, you got to pay them for it. Participation being that they got to have an adequate network. They have to allow all types of providers who wish to be on the panel, but it's not an any willing provider statute. Doesn't mean that they have to allow any individual provider that wants to be on panel. But they have to allow some chiropractic physicians, and it has to be an adequate panel. And that was a very key in all the bills we got in Oregon, an adequate panel, not just some token numbers of chiropractic physicians. So I don't know if I'm answering your question, but it really lays out the legislative history in Congress and in our state, and makes logical conclusions, talks about floor speeches. All those things are absolutely golden in a court of law. Where they end up, I mean, this was not some kind of golden panacea that fixed everything in Oregon. It's a continued battle, but and we've just had a conversation with a law firm explaining all this and the possibility at some point, if needed, to do a class action if necessary. But we believe that the movement towards this universal health plan, and they have a universal health plan governance board that I've been testifying from. They're really laying the foundation. And without going into details, because we know how in Massachusetts how it failed, in other places it's failed, Canada it's a disaster. But the way it's structured, the Oregon Health Plan is structured here, I can see how it could actually possibly work. And a lot of that has to do with the Health Evidence Review Commission and prioritized list, meaning the things we're going to cover has to have good evidence that they actually work. And if you just show this high level evidence, generally means large randomized controlled trials, we'll cover it as a state, because we don't have endless money. We got to be good stewards of the money that we have, federal and state. And perfect example is all the percutaneous interventions, all the injections that you hear about. Plasma-rich protein injection, plasma-rich protein injections, stem cell. We've got a newer one that's out, nerve ablations and blah, blah, blah. They're very, very expensive, and there is no high quality evidence that they work. Well, I'm all in favor of those not being covered. And there's still going to be some commercial health insurers involved for those who want kind of concierge care, the ultimate care, but they got to pay for it. So that, the long and the short of the legislative council opinion, it does not have the force of law, but these opinions, really going through all the history, really have a significant impact on the legislative assembly, on the members and committee. Right. When you bring that up and you show what LC came up with, and I do all that behind the scenes before it gets to committee. I educate them thoroughly, and also to get agencies to go into rulemaking to further clarify the meaning and intent of that piece of statute.
Right. One of the things you mentioned a little bit earlier was the whole issue on quality or performance measures. And in the law, is it correct in saying that there's nothing in there that prohibits CCO, for example, from establishing different reimbursement rates for providers who are providing the same service, unless the difference in rates is based on quality or performance measures? And that then it remains to be seen how broadly the exception for, we'll say, quote, quality or performance measures will be applied. Is that correct? Am I correct in interpreting that?
That's absolutely correct. They can discriminate against healthcare providers based on quality or performance measures, meaning they could pay them more or pay them less based on outcomes, which really favors us in the musculoskeletal realm. Mm-hmm. But they just can't, out of the gate, pay me $50 for 1 to 2 areas of spinal manipulation, and an osteopathic physician $75 because I'm a DC and he's a DO or an MD, whatever. But based on quality performance measures, they can pay me less or pay me more. If I do a really crappy job, they can bounce me off the network. But they can't, out of the gate, discriminate against me simply because I'm a chiropractor and pay me less based on nothingness. So, and it's very key is getting this solidified, because the insurance division is stuck on the CMS equation. which is discriminatory in and of itself. And I'm slowly starting to educate folks to that.
Mm-hmm.
Because the large hospital physician organizations, there's a name for where all of the healthcare providers are actually employees, really disadvantages us because a great amount, as I say, of our disposable income is spent on staff, maintaining a facility, and buying equipment. Well, that puts us at a huge disadvantage.
Right, right. And this is, this is a breakthrough law in the ruling that came out recently. And then while the legwork you've done is arduous, it can serve as a template for other states. I know Missouri is working on similar legislation. Would you be willing to help other states in this area if asked?
Absolutely, absolutely, and actually have been through the years. I've had several meetings with online meetings with boards of different states. And I have to tell you, this is a perfect segue into this, and that is, this all takes a lot of time. And and chiropractic colleagues have an expertise and knowledge about what we do and this kind of stuff well beyond any lay lobbyist in their state, and who generally will have multiple clients. They can spend only so much time with limited knowledge and understanding of our issues. So what I have tried to get other states to do is what my state did, is they hired me as their lobbyist. I'm still in practice 3 days a week, Monday, Wednesday, Friday, but I went in 2005. It was all by happen chance under emergency. We had to fire a lay lobbyist who decided he wanted twice as much money as his contract called for, and the session was just starting. The ink wasn't even dry in his contract. And so I was just going to do it for that 2005 session. I was seeing patients 5 days a week and every other Saturday morning. And so that was 20 years ago. And problem was I was just too good, knew too much. And I saw it was not rocket science. And here's the key. So what I'm suggesting is that states need to consider, you got to pay that chiropractic colleague enough to at least make up for a large percentage of the money lost lobbying. Now, I say I still work 3 days a week, Monday, Wednesday, Friday, and I took off Tuesdays and Thursdays so I could go lobby around the state and go to functions and so forth and be up at the Capitol during session on Tuesday and Thursday. But invariably, the committees, the hearings that I've got to be at to testify on our bill or against something else, invariably it'll be on a Monday, Wednesday, and Friday. And I've got to schedule a whole morning of patients out. Well, that's costs money. So states really need to consider, you've got to pay that colleague enough to where it replaces at least a large quantity of that income, so they have the time to do this sort of stuff. Because no lay lobbyist can duplicate this kind of work. And for instance, how are we doing on time?
We got a couple of minutes yet.
Okay. Well, in 2011, I was placed on what was known as the new Health Evidence Review Commission. It was our commission made of almost all medical professionals who go through the medical literature along with Oregon Health Science University and look at the level of evidence to determine what the Oregon Health Plan is going to pay for and what it's not going to pay for. And we would meet every other month, and then I would be on a subcommittee, guidelines or value-based benefits subcommittee. They were all determining what was going to get paid for. Because of me sitting on that and these boring meetings, which 90% of everything they were talking about had nothing to do with what I do every day, or my colleagues, every once in a while then we would come up or something related to us. And because I was on that, chiropractic care is now covered under the Oregon Health Plan or Medicaid. And in my local CCO, there's no limitation to care. There's no pre-authorization. There's no referral requirement from a primary care physician. And the payment is less than half our normal fees, but we're in. And that's nature Medicaid. And so having a colleague that can do this amount of work because you're paying them, and they're, it can probably be someone that's like me. He's like I say, I've been semi-retired for 20 years. That's kind of semi-retired, like, that can spend the time. You've got to replace some of that income. I really think states should consider looking into that, and I can help them with that in my experience too.
Well, that'd be great. Well, thank you. I'm going to thank you, Dr. Saboe. This has been a real treat to learn more about this very important win for chiropractors and other providers in Oregon as we work here in Washington to hopefully someday soon get a proposed rule on the federal level. This can certainly serve as a template, again, not just for other states, but I think here in Washington as well. And we're going to be working with the agencies involved. There's 3 agencies involved, Treasury, HHS, and Labor, and make them certainly aware of this good work that you and the legislators have done in Oregon. I want to thank you, Dr. Saboe. This has been great. And I want to thank you for all your work on the legislative committee as well. And we'll see you at our meeting later on.
Before you leave, I want to thank you for all your work and all you've done for the ACA and my profession. So thank you.
Yeah. Well, you talked about that history earlier, going back to Tom Harkin and Chris Dodd. And I still see them here around town, and I remind them of the great work they did in the Senate. And as you recall, they passed the Senate bill as is. The Affordable Care Act. They did not even conference with the House because of the death of Senator Ted Kennedy, and so they had to get it across the finish line pretty quick, and they did. And our bill was in a good shape, and now we got to make it better. But thank you for all your work, and I want to thank you again from the ACA. Thank you.